All right, moving on to our next speaker. Our next speaker is Dr. Olukemi Olugbade. She is a public sector physician, public health consultant, and healthcare expert with over 20 years of experience as a medical doctor and 10 years as a trained field epidemiologist and researcher. She's an alumna of the University of Ilorin College of Medicine, holds an MBA from the Metropolitan School of Business Management UK, and is a fellow of the West African College of Physicians in Community Health. She was also recognized as one of the top 100 career women in Africa in 2023. Her expertise covers public health, Her expertise covers public health, global health, health systems strengthening, research policy development, and capacity building. She's passionate about mentorship and leadership development. She also coaches young public health and medical professionals, helping them grow their careers and make meaningful impacts in healthcare. So, to take us on the topic of public health portfolio development, let's welcome Dr. Olukemi Olugbade. The floor is yours now.
I'll be continuing on what the first speaker has laid a foundation with and highlighting, certain important areas that I would like us to pay attention to. So my name is Dr. Olukemi Olugbade. I'm a public health consultant and field epidemiologist, and I work at the intersection of primary healthcare, health system strengthening, health workforce development, and mentoring and coaching public health professionals to position them for global opportunities. And so today I'll be talking about building a public health portfolio, how to document your impact, leadership, and growth in public health, as these key elements have been found to be very important when it comes to positioning oneself for global opportunities. So at the end of this session, it will be important to understand what a public health portfolio is. The first speaker had, elaborated on that. And so it will be important to learn why portfolios matter, to explore current and future trends, because this will be very instrumental to building your portfolio. Public health is, very wide, very interesting, very busy, and there's so many areas that one can focus on or specialize in. But it's very important to identify your skill sets and then what the public health market is also saying, because we must have a health workforce that is very flexible and adaptable to, trends and patterns. So from then on, we will now identify essential portfolio components and develop a career growth action plan. So I would like you to tell me what you do in the comment section, in the chat box. What do you do? What is your public health career goal? And where are you now in achieving that goal? And if you have a public health portfolio, you can share your portfolio, because, this group of participants has a dynamic mix, and you may be able to find a contributor, collaborator, colleague, friend that you might even find yourself working together with in the future. And it's also an opportunity to network. So share your portfolio, share your LinkedIn, and tell us what your public health goal is and where are you in achieving that goal. So in the context of a public health portfolio, it is a curated collection of your skills, experiences, achievements, your leadership roles, if any, projects you are as a public health professional or practitioner, and it helps whoever is looking at your portfolio to understand what you represent and what you have done so far. So essentially, a public health portfolio Okay, please forgive me. The network in my end has been it has been fluctuating seriously, but please bear with me. So like I said, it is a curated collection of skills, experiences, and everything you've done so far in your career journey. I'll have to reshare. I don't know if you can see my screen.
Oh, your screen isn't up yet. We can see it now.
Okay, so essentially it is your professional identity, who you are as a practitioner or a professional. And the reason why portfolios matter more than ever is because modern employers want to see practical experience. They want to see, hands-on competencies and capacity. They want to, be able to truly verify and identify your skill sets, not just based on what you have written in your CV or in that portfolio, but what you have done, right? So when it comes to public health, Like I said, there are different subspecialties in public health, from environmental health to occupational health to public health nutrition, mental health, epidemiology, social and rehabilitative public health. Those are the areas that deal with, inclusion of persons with disabilities or differently abled people, vulnerable populations, children on the streets, all that's the social aspects, of public health. So that's a very interesting and broad area. And then research, biostatistics, and a whole wide range of different subspecialties and areas of practice. Now, for most employers, they want to know if you can do what you claim you have done, and how will they ascertain that if there's nothing they can work with or refer to. So this is why a portfolio matters, because it shows how diverse your skill set is, how capable you are, what exact competencies you have, and how those competencies align with whichever project, program, or role that the person or the organization reviewing the portfolio is interested in. Portfolios matter because they want to see leadership potential. Public health leadership is a very core, is the heart of public health practice, because a lot of the interventions, and responses in public health has a lot to do with coordination, has a lot to do with organization, taking, on the spot decisions, right? And being able to manage a team. So how do you, highlight that? How do you express that if you've not had the opportunity to be in those kind of positions, right? So public health leadership is very important. At the moment, there are quite a number of disease outbreaks that are ongoing, in global health, and then if you're even looking at Africa as a region, so I'm sure you've gotten information or read about the hantavirus cruise ship outbreak, and then the Ebola virus disease outbreak that has been declared a public health emergency of international concern. Now, for these public health events, you must have a certain level of coordination, organization, and response that must be taken responsibility for by a team and a leader. So at the global level, there's a coordination agency that responds to outbreaks, and the lead is the World Health Organization. And then for the countries where these outbreaks happen, they already have a system called an incident management system, where all the different pillars in the response team have certain tasks, roles, and responsibilities. So if you are going to, like, for example, apply for the role of an epidemiologist, they want to see that, okay, has this person led a team? Does this person have epidemiology skills? Has this person responded to an outbreak? Has this person carried out surveillance activities? Has this person managed, like maybe a treatment center? Or has this person been involved actively in emergency coordination and response? So all these things, if you have those experiences, are put together at a glance, the recruiting organization or whoever is recommending you sees that, okay, this person has the skills, and because you have what they're looking for, then you'll definitely be strongly considered, right? But if you don't have, even if you had those experiences, right, but you have not used the right words to reflect the skills, then it would give an impression that those skills are not there. So your portfolio must be well curated. You must use certain keywords that reflects the job description, the role, or the job expectations. Communication skills are also very important, because we're saying that in putting together your portfolio, you must curate the things that you have done. And curating has a lot to do with communication, because your portfolio is communicating, like we previously said, your professional identity. So for you to be able to put a portfolio together, you must have very good communication skills, because you're trying to express, you're trying to, address whatever needs that whoever you're sharing your portfolio with wants to, get information about. You're sharing information about your education, your exposure, your experience, your expertise as in form of an evidence. Your portfolio is the evidence of your professional identity. So communication is very essential as a public health skill, right? Because you're going to do a lot of health promotion, health education, risk communication, community engagement. So it is important, that you know how to communicate all in public health, in things like addressing misinformation, in things like, giving information to non-health populations or non-health audiences. Communication is an essential skill, and also a very important health public health specialty, that's health communications. So your portfolio must be well communicated, and you must also highlight the fact that you have good communication skills, because it's very important in public health as part of our core practice. We have a lot of myth busting that we do. We address myths every day, misconceptions, misinformations, disinformation. So you must be able to communicate well in public health. Again, digital literacy is a non-negotiable. And the reason is because we use a lot of tools in public health education, in public health practice, in public health research. It's very important that you must have very good digital literacy. So when it comes to public health education, quite a number of the tools that you're going to use to learn are digitalized. Quite on the field, quite a number of the tools you're going to use to collect data are digitalized. Quite a number of the tools and software that you're going to use to analyze your data are digitalized. Quite a number of the tools you're going to use to present your data and communicate or disseminate your findings are digitalized. And now with the application of AI to public health, information, education, research, and practice, is very important that one, is brought up to speed on all the skills, because the skills keep changing daily and different skills are demanded for different roles. So this is also very important because most employers, recruiters, organizations, public health teams are looking for people that have digital health capacity, because it makes work faster and smarter, right? So it's an essential skill to have, and your portfolio must highlight this. Evidence of impact. Public health is about impacts. It's about outcomes. It's about, the difference you have made. Population of 100,000 people, there was an outbreak, you intervened, and you reduced the expected mortality from maybe 50% to 5%. That is something substantial. That is a win. That is a positive outcome. Or in a particular community where pregnant women were not, they have a health facility, but they were not accessing any kind of maternal health care in pregnancy or even after. Most of them were delivering at home. There's very high mortality rates in that community, and then you came in with an intervention that improved antenatal utilization and vaccination uptake, and there was significant reduction in mortality. That is an input in newborn children and even in the mothers. That is significant outcome. That is something impactful, and so your portfolio must reflect this as well. It's not just listing skills, excuse me, or listing, I went to Harvard, I went to Johns Hopkins, I went to London School. What did you do? Or what have you done so far? So it's good to have, global education. It's fantastic to have all the skills, but then how have you applied them in the real world context? So those things are very important for organizations to see, and it must be reflected in your portfolio. Traditional versus modern portfolio showed that traditional portfolios were degree focused, local opportunities, passive networking. I just said it now, like a lot of, before now, a lot of recruiters and organizations are very, they usually get impressed, with people with maybe overseas education. Oh, this person went to Harvard for their master's, went to Johns Hopkins for their PhD, and did their postdoc in London School of Hygiene and Drug Government. All those things, they look very nice on paper, but right now, it's beyond degrees. Modern employers and organizations, they're looking for skills. They're looking for hands-on impact, right? That gives visibility on a local, national, regional, and even global scale, right? So all those packing degrees, doing different certifications alone may not be enough. It is important to see what you have used those things for. Traditional portfolios used to look at local opportunities. What have you done in your space, in probably your institution or your training center or your local community. But now modern portfolios are looking at global opportunities. And so that's why now I'm seeing, and I like it, and I'm encouraging, a lot of young public health professionals, practitioners, and people who want to specialize in public health to look at global opportunities. When I was introducing myself, I said I mentor and coach, young professionals to connect to global opportunities, because that is where your impacts can be seen, felt, and recognized, right? Going for international meetings, international seminars, webinars, conferences, especially, right? And doing joint collaborative research with colleagues from other countries, which can either be physical or virtual. It's still impactful, is something that everyone should aspire to. And it's a big difference between traditional and modern portfolio developments. Before now, people were not particularly inspired to work beyond the shores of their country, but now it's a core metric for scoring people. In fact, there are some organizations, when they do maybe a request for proposal or a consulting opportunity, they'll ask you, in which countries have you worked, right? So having exposure beyond the shores of your country gives you an edge. And the reason why is because in public health, there is what we call cultural competence, and cultural respect, so to speak. If you're someone that has a lot of skills, and then you find it easy to navigate in an environment different from yours, it means you have an exceptional skill, because navigating a different environment from what you're used to shows that you're highly flexible, you're emotionally intelligent, right? You have cultural respect and cultural competencies. You can engage well, so you have good community engagement skills, and likely you also have good conflict management or good conflict resolution skills. So it's not just that, oh, you worked in another country. It means something. It means that you have been able to, exhibit the kind of resilience that that organization or that role is looking for. You are highly adaptable. You can, work in any environment, either a very highly volatile environment or, maybe like a humanitarian emergency kind of setting, or a place where there are displaced people that need, maybe mental health or psychological support, psychosocial support, So those particular um, situations or scenarios reflects a particular skill, right? And in putting together your portfolio, you must also highlight those skills and competencies. Traditional portfolios used to look at passive networking. I mean, okay, fine, you work with a team, maybe in your department or in your institution. But now modern portfolios are looking for people that are multidisciplinary in their orientation, right? So you're a medical doctor, specialized in public health, you work with nurses, you've worked with microbiologists, people that are in the lab, you've worked with vets, people that take care of animals, you have One Health expertise. That means you work with other team members that are not necessarily physicians, right? You work with people in environmental health, you work with psychiatrists, you work with, different kind of disciplines. It's a very strong signal that you're a team player, and that you're very versatile, and this you must reflect in your portfolio. So traditional versus modern portfolio shows that the trends have shifted, and we must also, make the necessary adjustments when we're putting our portfolios together. And as we build our portfolio and as we engage in certain tasks and roles and responsibilities, you must have a very global focus.
Sorry, Ma, your screen is no longer being shared.
Okay, so I just saw that and I will reshare. Okay, so I just finished, the traditional versus modern portfolio and then going to current trends in public health. Seems every time I do the full screen, the screen share, and so I'll just leave it this way. Okay, so current trends in public health is looking at digital health. I'm not seeing any charts. I don't know if some people had put their portfolios in the chat box. If you have, great. If you haven't, it'd be nice for you to share your portfolio so that you can even get feedback. If you are interested in getting feedback about what your portfolio looks like, I can, have a look at it and, share with you, excuse me, what you can do to improve it, right? So looking at current trends in public health, digital health, AI in healthcare, they are trending at the moment. Now, it's one thing I want to encourage young professionals to do is that you must not get overwhelmed and you must not get confused. And the reason is because, okay, so today somebody is saying, oh, I'm using this particular tool, I'm using Moara AI for systematic review. Another person will come and say, I'm using Synthesia AI for systematic review. Another person will come and say, I'm using Gemini AI for this one. I mean, there's so many tools, so many softwares, the pool of researchers and public health practitioners on a daily basis are being bombarded with different, softwares for smart work, different softwares for data analysis, different softwares for maybe referencing, if you're someone that writes papers a lot. As much as these tools and softwares are, you must not get bombarded, because we are saying, oh, this is the current trend, this is a good skill to have, but you must find a way to always focus and niche down, right? 2 or 3 tools for a particular skill or, sets that you are interested in, right? And then make sure that you master it to the best of your ability, okay? Because if not, different things change every day. And if you keep on running from one tool or one software to the other, you will get overwhelmed, you get confused, you even get burnt out, right? So you have to have a focus of interest. Like, okay, I want to work in this particular organization, I want to work in this particular country, I want to work in this particular space. What are the expectations for these 3 levels that I am aspiring to, right? So if you want to, maybe let's say you want to work in WHO, and then you want to work in the Afro region, you want to work in Africa, right? And then you want to work in, let's say, mental health, right? There are certain skills you must have, there are certain capacities you must have developed over time, right? And then there are certain tools that are used in that space. So you focus on those highly adaptable tools to practice in that space, and you make sure you master them well. Because what may be valuable in mental health might be totally different from what is valuable in occupational health. You understand? So you must define your area of interest and then make sure you're the best in that area. Health communication also trending. For you to be in health communication, you might be able to push this skill or area very well if you're someone that are very good with social media. So you can combine maybe social media management skills, right, using different platforms with your health communication. I'm sure a lot of you know Apropos Doctor. right? Chinonso Egemba. And his style of health communication, it's such that at every level, people can relate. If it's a grassroots person that doesn't even have any idea about health care, you can get the information you need. If it's, let's say, like a middle class person, you understand what he's saying because he speaks relatable English. He doesn't use medical jargon. And then even if it's a C-suite executive, you can relate to and understand the topic he's talking about because, his message cuts across audiences. You understand? And then he leveraged social media, right? And he uses a lot of storytelling. So, I mean, this is a current trend in public health and a very strategic way, right, to pass information and to dispel myths and to address misinformation. So, very important area of specialization. And if it's something you're interested in, you can now build your capacity in public speaking, community engagement, risk communication, social media, and storytelling. Another very important area right now is epidemiology and surveillance. We just talked about, outbreaks, ongoing, and, if you have epidemiology and surveillance skills, you have a strong chance of working on the field, right? Because most outbreaks are, community and population based. And so it will be good for you to, if you have this area of interest, to build your portfolio in that capacity. You engage with epidemiologists, you volunteer for outbreak responses, right? And then you work with teams to ensure positive outcomes in the communities that are, experiencing the outbreaks. And with those experiences, you can now build your portfolio to reflect, that skill. Climate and planetary health is also very important now because of the different influences of climate change on a lot of sectors, from agriculture to the economy to mental health to education, how pollution is affecting the ozone layer, how that is also affecting temperatures across different countries where, the heat is melting ice and it's causing flooding, So there's some, and the impacts on housing, the impacts on, farming and food security. So you can see the connections, right? If that is your area of interest, your portfolio too must reflect all this, connections like, oh, you're interested in climate and planetary health, and you've written a paper on the effect of climate change on agriculture, on education, the intersection between climate and planetary health on food security and malnutrition in, school-age children, all those kind of things. It's all about interest and creativity and knowing how to tie everything you are doing together in such a way that it will show your, your influence and your impact. Okay. Now, when it comes to public health entrepreneurship, it's like the business side of public health. So business in quotes, right? Because this is a side that a lot of people, see and think, oh, people in public health have plenty of money, So this side has to do with finance, economics and all that. So if you're interested in health economics, healthcare financing, and fundraising, right? So this aspects where you, write grants, write proposals to request for funding to implement a particular program or project is also very important because for all these areas that I've talked about, from maternal and child health, to epidemiology to digital health, you need funds to run all these activities. Okay. And then the other side of entrepreneurship is also consulting. So in this capacity now, as a public health professional or practitioner, you have skills that you can monetize. Okay. You consult for an organization and you are paid for your service. You speak at an event, right? And you are, rewarded for that knowledge that you have shared, and you teach, students, and you're paid, for the hours that you have spent with them and all that. So, I mean, depending on one's interests, every public health practitioner is a potential entrepreneur if you decide to monetize your skills, your competences, and your knowledge. So future trends and projections, future-ready professionals will need digital fluency. Like I said, you would have to be able to use a number of tools, but it will be good to focus and specialize so that you don't get overwhelmed or burnt out. And even if you focus on one or two or three max, it will be good to know about the existence of others. Like now, I know that a lot of people are crazy about, is it Claude now? Is it Claude or Cloud? Claude, I'll say Claude, right? A lot of people are crazy about using Claude for brainstorming, for writing, for LinkedIn engagements, for a lot of things. But interestingly, I've never used Claude before. I know it's good. I know it works for a lot of people. They even use it to design their portfolios. Well, I would rather use something else. But I know how it works. I know how it functions, even though I don't use it. Do you understand? So if people even have a conversation about, oh, can you use Claude? I would say yes, because I know how it works. But I haven't used it, but I know how it works. So it means I can use it. So that's just it. So you might not have to know about all tools, but it will be good to know how it works so that if that tool is the only approved tool by a particular organization you're interested in working with, or who have reviewed your portfolio, you can, in less than 24 hours, review what the tool is like, what it can do, and then you can be able to use it. You understand? So that flexibility and adaptability as a skill is very important, right? So you have your areas of interest and your areas of specialty, but it will be good to be open to, new things, such that if you need to use that tool or that software or that resource, it will not be a problem. Okay. Digital fluency, global collaboration. We talked about this adaptability. Just use being able to use cloud as an example. Thought leadership. Now, thought leadership, visibility, and influence are very big on LinkedIn, right? So, thought leadership is about sharing your thoughts as a leader. Talking you're sharing your thoughts might be that you're teaching something, you're sharing your experience or expertise, you are sharing your reservations about something, or you're even being totally contrarian. So what that means is that, like you have a very strong impression about a particular subject matter. Some people, do it intentionally. In places like X and Instagram, they call it rage bait. Like you say things that will make people upset, angry, and you start a particular conversation or a trend of thought, and then you're seeing 2,000 comments. And you're like, what are people talking about? It's intentional because the person is trying to generate and stimulate, conversation, right? I will make people think. Okay. So there's some people like that on different social media platforms. Everything they say is totally different from what everybody's saying. It's intentional. That is their brand identity, right? That's what everybody knows them for, right? And it helps them to, express themselves in a way that they are seen as thought leaders in when it comes to, contrarian situations. And that is the attribute of a critic or a reviewer. You understand? You must be able to analyze objectively without emotion, right? But still being sensitive to people's feelings. So thought leadership can take different forms or formats. Okay, so you can be contrarian, you can be a teacher, you can be a coach, you can be a mentor, you can share insights about your work based on your experience, based on your what you see on a day-to-day. There's some platform users, like especially on on Instagram, I see things like, Diary of a Nigerian Kitchen Lover, Diary of a Niger Girl, Diary of there's this lady on X, she's Diary of a Female Surgeon. So on a day-to-day, they share their experiences, in their different areas of practice, the good, the bad, the ugly, and the totally bizarre, and the very interesting too, So they because of these things they share in front of the scenes and behind the scenes, they have a large following because there are people that are interested in maybe their life, their lifestyle, the job that they do. Like now you could see a young girl wants to do read medicine, follows Diary of a Ninja. I mean, Diary of a Female Surgeon, wants to become a surgeon in future. So everything she does, says, and shares, she follows it intently because that person's journey inspires her, right? So in that context, that person is a thought leader. So that's is also something that your portfolio should reflect. If you are someone that writes a lot, you have articles, and the portfolio, I mean, the role that you're interested in has to do with writing. Like maybe they're looking for a medical writer or an academic writer or a um or a researcher, right? You would like to see some of the things you've written. So your portfolio must include links to your articles, your blogs, your thought pieces, your research work, and whatever interesting um footprints, your digital footprints, whatever interesting digital footprints that you have online and sometimes even offline. So even things that are still in peer review or that are in draft, if you feel that it is relevant to that particular job, share as well. And all these things, when put together, are what gives visibility and influence, especially on professional platforms. Talked about. Let me reconnect so I can share my screen. Okay, so as I was saying, I coach early and mid-career professionals, and I use a particular framework from users because I like LinkedIn as a platform, and I believe it's a platform that I can also call your portfolio. Your LinkedIn profile is also a portfolio because it takes into consideration the different things you have done, and the way it is structured, it allows you to be able to share, everything we said a portfolio is. I mean, everything that has to do with your professional identity. It gives you the ability to showcase all those things. So your education, talks about your degrees, certifications, and everything that you've done in context of your academic pursuits, right? And your academic achievements. Then exposure, right? So I'm talking about the five, components of a strong portfolio that also is sort of the basis of the framework I use for coaching and all that. So exposure has to do with what opportunities have you been able to harness. So at some point I saw someone saying something like they're just starting in public health, they don't know anyone, they've not done any research. I'm trying to look because I think I took a screenshot of that, So he said, yeah, you've not had much experience, haven't led a team, not gotten involved in many projects, and you cannot quantify your achievements and impact. How do you go about building a portfolio? This is very important. You must have, everything you do, you must have it in front of your mind that you are on a journey and there's a place where you want this journey to, right. You understand? And you have to be very intentional about it. So you've not been measuring impacts, you have to start measuring it. You've not been documenting anything that you're doing, you have to start documenting it. You've not done any research work, you have to look for research that you would do, right? Because you have to be in spaces, right, where people are sharing these opportunities. Because there's so many opportunities, but I noticed that people don't know how to leverage on those opportunities. And that's why I like LinkedIn a lot, because it's a platform that allows you to showcase your professional identity, allows you to showcase your portfolio, and you can now connect with people that can help you to achieve all those things. You understand? So, and that's why on LinkedIn, they'll say you have connections, because that platform is about connecting, right? So education, degrees and certifications, exposure, research projects, and opportunities to gain hands-on experience on, like real time. You have the opportunity, maybe for example, now you get a volunteer role, and that role has to do with maybe collecting data, right? And they will train you to be able to use a particular tool, right? And then if you can use that tool, you've mastered it, and you're able to okay, I'm trying to share now, I'm not able to share. So I don't know if I can be enabled to share my screen. Okay, so let me continue. So and they are trained on how to use a tool, like ODK, Open Data Kit, you are taught, or Enketo toolbox, Kobo Collect, you are taught how to use it to collect data, right? And you've mastered that skill that way. And so any other project that requires that you use a particular tool to collect data, because you have had that previous exposure and experience, the next opportunity becomes easier and more accessible. You understand? Then experience, this has to do with that exposure you have gotten. You now replicate it in different roles or in different opportunities, right? And quite a number of the things that we do every day, even as students, we don't even know that we are gathering experience, right? Like let me use medicine now, because I'm a doctor. So in clinicals especially, you start with clinical clerkship. You are clerking patients, you're taking history, you're doing physical examinations, you're doing investigations, you're managing patients, you're working as a team, you're doing presentations. If somebody repackages that thing for you, you'll be surprised, like, oh wow, so these are all the skills I have, from just that experience being a clinical student in a particular posting. We're talking health education, we have health, yeah, because for every patient that you're going to interact with, you're getting information from them, right? So, and then you're engaging with them based on their condition, and you're giving them counsel, right? So health education, health information, advocacy, because for some of these people that you're taking care of, you have to, make a case for them to get a particular kind of care, right? And by the time you itemize all those things, public speaking, team participation, team management, and all that, you have gathered skills that may be very valuable in a particular role. So even as a student, you can, get exposure and experience that you can use to generate a portfolio. It's all about the language that you use to express those things. And expertise has to do with mastering a skill, right? And then using that skill to make an impact over time. Okay, so nobody becomes an expert neurosurgeon in a day. It takes time, it takes effort, it takes intentionality. And then when you have mastered that skill, you can now say you're an expert, and you have to show this expertise in your portfolio as well. Now, evidence. So education, exposure, experience, expertise, evidence. Evidence has to do with the documentation of what you've done. So if you've not been documenting the things you've done before, you've done an outreach, you attended to maybe market women, you took their vital signs, checked their height, their weight, calculated their BMI, you did their blood pressure, you counseled them, you gave a health talk, all those things. They are valuable public health skills, because many times, depending on the organization or the role, most of the things that are required are relatively the same, across board. You understand? So like now, if you see a role and they say they're looking for, there was something I saw today, was a global opportunity. They said they're looking for a global health analyst and a global health associate. And then when I looked at the job description, I was like, I mean, even a medical student in Nigeria can apply for this because these are the things that they do every day. You understand? But if you don't know how to put together these things that you do every day that you have, you might not be, you will not even think you're qualified. Meanwhile, you're more than qualified to apply for those positions. You understand? So if an organization now says they're looking for people who have experience in non-communicable diseases, right? Or they want to do a project and they're looking at a cardiometabolic indices of sedentary residents, in a semi-urban populace. Do you know that if you've done a health outreach in a market, you can conveniently say that you have that experience because you did blood pressure, you did BMI, you did waist hip ratio of people, of markets, men and women, right? Who are sedentary, by the way, because they're mainly sitting, right? And you gathered all that information and you just kept it on your phone or you just kept it on your laptop. Do you know that that information you have, that activity you did is a paper, is a blog, is an article, is something that you can use to apply for a grant and get funding to scale up that outreach to a larger level. It's something you can use to apply for a job that is asking about a global health associate to run a project looking at cardiometabolic indices in sedentary residents of a semi-urban community. Do you know that? So these small things that we do every day that we think they're not big deals, you can express them in 10 different ways. Everything's all about packaging. But the packaging is not the packaging of a lie. The packaging is the packaging of reflecting, what you have to fit that area of interest or that area of expertise or that job or that contract or that consulting opportunity. I hope we're following. If you're following, please put in the chat box, I'm following. I hope we're not bored too. So the evidence of everything that I have done must be reflected in whichever platform you want to use as your portfolio. So if you're using LinkedIn, right, everything you have done must be reflected in your LinkedIn, from your about section to the featured section, right? From about section to featured section to the parts of education, your skills, even the recommendations, because LinkedIn allows people to give you recommendations. If somebody gives you a recommendation and it's a very glowing recommendation, it's enough for an organization to look at your profile and reach out to you, right? And that's one good thing about LinkedIn. Anybody, once your profile is well put together, anybody can look at your profile and send you a DM and say, we have this opportunity. We would like to work with you on this particular project. I've gotten a lot like that. And I know quite a number of you in this call have too, but your profile must be very well positioned to attract that kind of interaction. So that's why it's important to have a portfolio. Okay, so the 6 pillars of a strong portfolio: clarity. Your portfolio must be clear. It must say who you are, what you do, and who you serve, right? And so the person knows, oh, yes, this is the consultant I'm looking for. This is the public health experts I need on my team. This person, from everything I've read, their post, their profile, their picture, their featured section, the content of what they share totally aligns with the project that we want to do. Okay, so very important. Competence. For LinkedIn, there are places where you can highlight your skills, both soft skills and technical skills. Very important because these things too are considered when an opportunity opens up or is shared. Communication. Everything you say must be very well highlighted, detailed, right, and must also reflect certain keywords that any recruiter, if they put in those keywords, is your profile that they will see first. Connections. Your portfolio must reflect, like organizations you have worked, your schools, schools you worked with, organizations you have volunteered for, interned at, or you work in, because it shows that, oh, this person has a diverse set of skills. This person has worked in a school, has worked in, a church, has worked in a hospital, has worked in a WHO, has worked in UNFPA, has worked with NCDC, So it shows that, oh, this person is very well grounded, very flexible, very adaptable, very versatile. Those things mean something. Consistency and credibility. Your portfolio must show that you are an expert in the sense that everything that you do is in a particular broad scope. Like now, as a public health professional, you may have different interests, and across those interests, your portfolio shows what you have done. You might have a general interest, like now, maybe epidemiology, okay? And then your work now shows different aspects of epidemiology, from nutritional epidemiology to social epidemiology to environmental epidemiology to research to, surveillance, outbreak response. We know that this person truly is an epidemiologist. You understand? So there must be that consistency, like everything you do. Not today you are doing public health, tomorrow you are doing engineering, next to is not clear, right? So you must be consistent. Your portfolio must show consistency, especially in public health, because there's so many areas that you can have opportunities to work in. But at the core of those areas is your public health practice. Then credibility, everything you start, you finish, right? There are some people that they give them grants, right? And both the grants money, the projects, the reports, the team, there's nothing to show for it. Those things can be very damaging. So credibility is very important in public health, because you're going to work with teams, you're going to work with people that you always meet everywhere. Public health, as big as public health is also still very small. There are people that I've worked with in different parts of the country, and everywhere I go, somehow I just see them. You work with somebody in Abuja, and the next thing I see the person in Badon. Or you work with somebody in, maybe in Kwara, and the next thing, yeah, the person is on your team in Lagos. You understand? So public health is very wide, but at the same time, it's very small. So credibility is very important. If you are giving funds for a particular project, you must be accountable, you must be transparent, right? And you must start and finish your work, because most opportunities in public health are like contracts. So you start, you deliver on the project, you finish, you write your report, and you get your commendation or remuneration, or both, as the case may be. So those things are very important. So from your portfolio, it will reflect. If you're very honest, people will be able to see and say, this person, they always finish what they start. So we want that kind of person on our team. Just from the way you have chronologically highlighted all the things you've done, that can be seen. So how to develop a portfolio? Like I said, and I'm going to reiterate, identify and define your area of interest or niche, right? You love public health. Public health is very wide. You have to decide where you want to be, right? You can put 2 or 3 areas together, and you're consistent in specializing in them, right? And everybody knows, this person is epidemiology, this person is nutrition, this person is mental health, this person is reproductive health, right? So it's good to identify and define your area of interest. Then volunteer in public health outreaches and intervention. It's always good to start with volunteering, because many times that is the fastest way to learn, okay? By making yourself available to see how things are done, right? Either by observing, and then subsequently by performing. Join public health clubs and communities, and I like what PHIGA is doing, especially bringing early career and mid-career professionals together. In being in this kind of environment now, you're hearing this kind of things that other people who are trying to find their feet may not have the opportunity to hear. Assist with research. If you know anybody doing research, a lot of people ask for team members on LinkedIn. They say, "Oh, I want to write this project. Are you available to join me?" So many opportunities like that. And I have a group where I share quite a number of these opportunities, and I'll share the link with your admin and your team members, so that you can always have access to this information. Because in public health, information, I don't like to you. In Nigeria, we're Nigerians, we know how these things work. Connections are important, but how will you make those connections if you are not in spaces where those connections exist, right? So information, connections, very important in public health, because in interacting with people in your community or in a group or in a club, you might be able to get someone, if you work together often, that can even recommend you. A lot of sponsorships, scholarships, fellowships always ask for recommendation letters. But where will you get them from when nobody knows you, nobody knows about you, they don't know your work, they don't know your portfolio, they don't know your platform, they don't know your LinkedIn, they don't know your face, and you want to go find public health? You have to put yourself out there and connect with people that you can work with to build a very strong portfolio, little by little. Participate in webinars and career advancement activities like this one, that's, will give you information you need to, be more ambitious, so to speak. You can be more, you might be, we're all at different levels. Some people are just starting, some have made progress, they've done a lot, right? And you can still do more. Okay, and document and share your journey. So for everything you've done, like now you've attended this webinar, important to share the learnings, say what you learned, and how you're going to apply what you learned. And then you can even say, oh, okay, so from now on, I'm going to share my wins or share my, experiences, and then you're consistent in it. And that can even also get attention. Okay, so, and that is also developing a portfolio. Once you get attention and you start writing consistently, somebody, some way, somehow will reach out to you and say, I like everything you're writing. It really resonates with me. Can you work with me on this? And it could be a paid opportunity. And, that's how you just, break into a very interesting experience. So LinkedIn as your portfolio. LinkedIn helps you to build credibility, establish a personal and corporate brand, assess global opportunities, and showcase the 5 E's. So the 5 E's we're talking about: experience, exposure, education, your expertise, especially expertise. It's on LinkedIn, you can share content as posts, you can write articles, you can, highlight your portfolio. In fact, that's your portfolio. Do you know it's downloadable? It's downloadable, and you can, in some people have presented their downloaded profile from LinkedIn as their portfolio, because it has every single thing a portfolio should have, right? And for some other people, they are presented it as their CV. Okay, so LinkedIn is a very good platform to showcase yourself. There are other platforms, like Chidima highlighted, right? But LinkedIn in particular is a very good way to assess global opportunities, because there are people from different countries, different areas of practice, and There are people there that are recruiters, employers, team members, collaborators, partners. I got them from, the invitation for this event, from a LinkedIn connection. And from there, I'm here and I'm interacting with people that I've never met before, apart from people from my network that I invited. So it's a fantastic platform to use as a portfolio because it also allows you to connect with mentors, coaches, and collaborators. So the benefits of a strong portfolio: scholarships, sponsorships, fellowships, consulting roles, speaking invitations, research collaboration. So this part I want to highlight on a little more, right? So the types of portfolio you can build a professional profile portfolio. That is what LinkedIn helps you to do, right? You can develop a research publication portfolio. That's what ResearchGate and Google Scholar helps you to do. Project and program experience portfolio usually highlights all the projects you have done, right? And you can present this as a PDF. Presentation and speaking portfolio, you can have like a folder, of different slides, talks, webinars, workshops, and conference sessions that you have been in. Writing and content portfolio, all your articles, blog posts, newsletters, policy briefs, and thought leadership articles. You can have this in either Notion or Canva, right? Or as a Google Drive link that lists all those documents. So if someone says, "Oh, can you share your writing portfolio?" Is that Google Drive link where you have what's the word now? Uploaded all these documents, right? That you are going to share as your writing and content portfolio. Education and teaching portfolio, usually for people in academia, is always good to have this if you're looking for a job as a lecturer, right? So the courses taught, training materials, curriculum development done. You can have this in a folder as well, and you can share this with whoever wants to review, the institution or the school that is interested in your services. Volunteer and community impact portfolio. This one would be good to have like a drive with pictures, right? You can have pictures from different events. You can put them in folders. Okay, outreach to Ikwetumudu, Ife North LGA, Osun State. Outreach to Modakeke, Ife East LGA, Osun State. Outreach to Kaduna or Zaria LGA, Kaduna State. You just list everything, put all the pictures, everything showing your activities, everything you did. You can even put a summary, of the impacts, the outcomes, and then you put it in a folder, and then you have a Google Drive link, and you have that, close by. So anytime you're asked, "Oh, can we see your portfolio?" If you have a field work experience, you just share that. Certification and training portfolios, all your trainings, your certificates, certificate of participation, certificate of commendation, if you've gotten awards, everything. Put them in a folder, and you keep them so that if you have to share, you can share. Now, if everything here, it still can even be one portfolio, and this is also the way LinkedIn is, right? Everything here, from professional to research to project to presentation, everything you can also still put in your features section on LinkedIn or in your skills section or your education section, depending on what it is, right? Media and public engagement portfolio. If you have someone that maybe you had a TED talk, interviews, podcasts, features, social media engagements, if you're a media person or you're an influencer or you want to be one, all those things that you've done in that space, and put them together in a folder that has your pictures, that has your TED talk link, that has your YouTube interview or the podcast you attended. And then some of these things so you can share as posts. All those things build up as your portfolio. Achievements and awards portfolio, recognition, fellowships, leadership roles, everything you can put in Notion, you can put in GitHub, you can put in Canva, and you can also put on LinkedIn. Okay, so in summary, key takeaways: visibility and portfolio development matters. Consistency beats perfection. Your portfolio tells your story. That's where you are now. So when it comes to career development, like I said, you have to be very intentional. And this is something you can decide to do from this moment on, and give yourself like a 4-week target. So now we're in the end of May. So you can decide, okay, so from June, these are the things I'm going to do. Week 1, update my CVs. You can have different versions of CV, depends on your areas of interest in public health. You can have like a very full comprehensive CV that has every single thing that you have done. And then you can now break up those CVs into different, areas that you are interested in or you're targeting or you want to apply to in the future. Update your CV, update your LinkedIn, look at each section and then optimize your profile, right? Week 2, get career coaching if necessary to give you guidance, clarity, and, insights as to, okay, which area of public health should I even focus on, right? And then when you've done this, take necessary certifications, identify groups and communities to join, identify opportunities and start applying to them. Week 3, excuse me, by the time you gathered everything, you want to publish content and establish your presence by being active and visible, make posts, make comments, and you can even pitch yourself and send DMs by the time you've gathered everything you need to apply for opportunities. Then by the last week, reach out to mentors and network. And before you know what's happening, people will be reaching out to you too to offer you opportunities. So thank you everyone for your time, your attention. I hope you learned a lot. I look forward to your comments and questions. Thank you, everyone. Thank you, PHIGA organizers as well. Thank you.
All right, thank you very much, Ma, for a very insightful presentation. I believe everybody has learned greatly from your wealth of experience and knowledge. I was even going to say we should go over the questions that might have been asked during the meeting, but it seemed like you answered most of them, if not all, during the course of your presentation. So thank you very much once again. And on behalf of PHIGA and the executives of PHIGA, we want to appreciate you for your time and for the time you spent with us, and then for being willing to share your knowledge with each and every one of us as we are aspiring public health leaders across Africa.
Thank you, everyone. Well done to the organizers. So I'd like to know if there are any questions that, based on the presentations from both Chidinma and myself, if we've not addressed any questions, please let us know.
Yes. All right. So if there are any questions that you might have over the course of all the two presentations we've had this evening, please also quickly send those questions in the chat box so we can attend to them as quickly as possible. And Ma, please, can you make Chidinma a co-host on the call? I think she might have left at some point, so she needs to be made a co-host again. But while we wait for that, please, if you have any questions, please send them to the chat box immediately so we can attend to them. Thank you. Okay, so it seems like we don't have any other questions at this point. So Chidinma, if you'd like to add anything else, please you can do that now.
Not really. I wanted to add the start and inline form. That's why I requested to do this. So the inline form became on the Zoom for the same.
So I can't hear you clearly, Chidinma. Chidinma, I didn't quite hear you. I didn't quite hear what you said.
Can you hear me now?
Okay, it's better now.
Okay, so I wanted to administer an inline form. But I think there's a problem with making a post. I guess we just send that as a mail while sending the output to you.
All right, no problem.
Okay.
Okay, so on that note, I believe we have come to the end of what has been an incredible and very impactful capacity building program, the day one. So, like I mentioned at the start of the call, this is a 5-day event. So we are continuing tomorrow, same time, 5 p.m. And we hope we are going to try our very best to keep the time, so we don't stay longer than we need to. So please let's all make it a point of duty to be on the call as early as possible, so we can soak up as much knowledge as we can from our speakers and the other speakers we have lined up. So to all of the participants, I want to thank you very much for your engagement and also your commitment to learning. I want to also appreciate the speakers, Chidinma and Dr. Olugbade. Thank you very much. Your presentations were really, really insightful, and I believe I speak for each and every participant here that we've learned a whole lot, and we're going to be able to apply what we have learned here for those that have not started, to create their portfolio, and to those of us who already have, to further enrich it, to make it better and much more valuable in terms of being able to use it for opportunities that may arise in the future. So thank you very much once again. And as we end this session, I would like to tell each and every one of us to be ready for tomorrow's session, and hopefully we gain much more knowledge and at the end of the day build our capacity, which is the goal of this program. So thank you very much, everybody. Have a lovely night rest and see you tomorrow. Bye.
Good night, everyone. Bye.
Good night and bye.